All right, let's go ahead and get that started. All right, we've got the recording going. So, good afternoon, everyone, and thank you for joining us for our BHAB meeting this month. It's sad to miss you in July. I was stuck in court in July, but today I'm good. So, start off with roll call. Chairman Andrew Van Winkle, I'm here. See, we've got Kim Taylor here. Craig Davenport's here. David Lund, I don't see here yet. Gail's here. Jackie Sowers here. We are Jamie Rostek, not here yet. Under Sheriff Thompson's here.
I'm here. Jamie
there you go, Jamie.
Okay, thanks.
Perfect. Thank you for catching me there. All right. Laura Moon, not present. Lita Phillips, not present. And Michael Lindsley, not present. And then we also have our other attendees, Ashley McGee, Nancy's, of course, here. Tom Ghost is, of course, here. Katarina Rice and Jessica Thompson. And then we've got a couple guests here. All right, so that we've got quorum, but before we get to our guests, has everyone had a chance to review the minutes from the last meeting?
Yes.
All right. Do we have a motion to approve or any changes?
This is Kim, so moved.
Thank you. Second?
Second.
All right. All those in favor?
Aye.
Aye.
Any abstentions or nays? All right, minutes are approved. So with that, let's go to Eric and the Mobile Recovery Cafe.
All right. Thank you very much. Can everybody hear me okay?
Yes, your volume is great.
Okay. So this is the first time I've reported to the county. So what I'm hoping to do is share, I'll introduce myself and then share a little bit about the Recovery Cafe and then what we're doing with the, we call it the pop-up cafe, what's happening up in Newport. So if I go out into left field a little bit, just let me know and reel me back in. So my name's Eric Hood. I am currently the manager at the Recovery Cafe Spokane, which falls under the umbrella of community-minded enterprises. I've been with community-minded enterprises for almost 6 years. My connection with the Recovery Cafe actually goes back further than that. I'm in recovery myself, and I have been a member of the Recovery Cafe. I was a member of the Recovery Cafe a year prior to becoming a staff member, so I've kind of seen it from both sides of the fence. I came there just looking to add additional support to my own recovery, and ended up stumbling upon a job position. I had no idea that that was the type of career I was going to pursue. I had some help from the people working at the cafe at that time, and became a staff member working. I was kind of the first face you would see when you come to the cafe, welcoming the new members, the front desk associate, and stayed in that position for about a year, and then transferred over to what we call the State Opioid Response and the Substance Abuse Block Grant contracts, providing services to people in recovery, all kinds of things, anything that would be a barrier for somebody staying in recovery or having prospering in their recovery, transportation and housing. I got to witness a lot of people getting their driver's license back, being with them, actually at the Department of Licensing. It was amazing. I stayed on that program for 3 years, and then about 2 years ago in November, the job opportunity of the Recovery Cafe manager presented itself, and that's where I've been for the last 2 years, still learning. So a little bit about the Recovery Cafe. It's the Recovery Cafe model is peer-based model, and it's been around for, to my knowledge, at least since 2004. It started in Seattle. The first Recovery Cafe started in Seattle. The Spokane Recovery Cafe came about in actually on Valentine's Day of 2017 is when we first opened. I wasn't there yet. I walked in the cafe in 2018, the year after that. But so it's an interesting connection between myself and the Recovery Cafe. As the Recovery Cafe in Spokane was opening its doors, that just happened to be the exact same week that I was hitting what I would call the bottom, where I finally decided to get some help and change what was happening in my life and get into recovery. I didn't know that until a couple of years later, but it's a really interesting connection to me, the way that came about. So the Recovery Cafe in the Recovery Cafe in Spokane came about in February of 2017. At that time, there were probably a dozen or less recovery cafes in existence, and now I think we're approaching 70, and they're nationwide. They're everywhere. We have one in Washington D.C., Indiana. They're all over the place. But last I checked, we're approaching 70 recovery cafes, and there's kind of two different versions of Recovery Cafe. There's an emerging member, which is a 2-year process through the Recovery Cafe network to where you're following the model, you're attending trainings through the Recovery Cafe network and completing obligations to the network. And then after 2 years, you become a network member, a Recovery Cafe network member. Spokane was one of the first recovery cafes to become a full network member back in 2019. And so fast forward to last year, I was contacted by a lady who worked for the hospital up in Newport, Washington. And we had both attended a training through the Healthcare Authority, and that had to do with the idea of a pop-up recovery cafe. And after that training, she reached out to this person, and they advised her to reach out to Spokane to see if Spokane would be interested in this idea up in Newport. I had also attended this training through Healthcare Authority, and up until then, I wasn't really familiar with the idea of a pop-up version or a condensed version of the Recovery Cafe. And I was contacted by this lady in Newport not even a week later after this training. So it was interesting timing how that worked out. So that was towards the beginning of last year. We spent most of last year kind of meeting and talking about what that would look like in Newport, meeting with different agencies in Newport, Andre Counseling, and kind of assessing the community need up there in Newport, which come to find out is extremely high. I got some assistance through the Recovery Cafe network as far as some guidance on what the network guidelines are on opening a condensed or pop-up version of the Recovery Cafe. So we held towards the beginning of this year, we held a couple of community events up there in Newport talking about the Recovery Cafe services. We had one that was open to the community and one that was more geared towards the agencies up in Newport to come hear about. We gave them a condensed version of our new member orientation that we show to our new members. And it was very well received by the Newport community. So we are actually up and running right now. We've had the doors open in Newport since April, and we currently have 20 members of the Newport Cafe.
Eric, can I ask you a question on the membership?
Yes, please.
So 20 up in Newport, how does that compare to Spokane?
So Spokane, back when I first started in as the front door associate, we'd been open for 2 years there. I think we were still under 100. We were somewhere between 50 and 100 members. Now we've moved locations twice now in Spokane, growing because of running out of places to run our recovery circles. So our membership in Spokane is now, it ranges between 300 and 350 members. And we have, we have one recovery circle group in Newport right now. We have 26 recovery circle groups in Spokane, all operating weekly. Did that answer your question?
Yeah, that does. I just wondering for a little bit of comparison there, and the number of members you have in Newport already just sounds amazing. That's great.
Yeah, one thing I noticed, or I am noticing that it's going to be a little bit different. I think because of the community of Newport. I think it is going to ramp up quickly, but it's going to be different than Spokane. I think once we get to a certain level, it's gonna maintain that for a while because it is such a small community. Whereas Spokane, we get a lot of kind of revolving. We have a lot of longtime members that have been there since I've been there, that they've completed any legal obligations they might have had, treatment. They just stay there because it's a long-term support. They like to stay plugged in too, so they're still maintaining their recovery. But Spokane, we see a lot of new faces all the time just because of the much larger population. So I'm expecting it to continue to ramp up, and at some point in Newport, we're going to get to kind of a maintenance level.
Eric, this is Kim. On the Community Minded Enterprises website, is there, say, a calendar of events at Recovery Cafe, or is there a separate website? And then also, do you have any plans to do potentially an open house so other folks can come see the cafe?
For Newport or for Spokane?
Spokane, please. Yeah, sorry for the clarification. Spokane.
We do kind of have, throughout the year, we have different member events that we run, just kind of member celebration events that are also open. That is open for the public to come in and see what the Recovery Cafe is all about. But yes, on the Community Minded website, there's a tab just for Recovery Cafe, and under that Recovery Cafe tab, they have the member calendar that shows the member events, the new member orientation, any specific events we might have coming up for that month.
Got it. Okay, thank you.
I'm looking to add that same type of thing for Newport also once we get going more days per week. I do much better in question and answer format, so feel free to ask questions.
So following up on that, the Recovery Cafe in Newport, you said you got it started with the hospital. Does it meet at the hospital or somewhere else there in town?
Oh, no, it does not, but that's a really interesting part of the story. So while looking, we looked at a couple of different locations up there and what might be possible. We ended up at a place called the Hospitality House, which is kind of the community center there in Newport. They have other recovery-based things that happen there. They have 12-step meetings. They have a program called House of Recovery. So I just think it's really interesting and awesome that we ended up there because there was already it was already kind of known as a place to go if you're looking for help.
Oh, it's great to have that resource there.
Yes.
Is there any talk about expanding this out to Lincoln County and some of the other smaller counties within the area?
There has been. That's been a little bit above my level, but I know that there has been conversations about continuing to expand out in the rural areas. Yes. When we get contacted, we've actually been working a lot with Colville. Colville received a grant through the Healthcare Authority also to open a recovery cafe. The difference with them is they didn't have any background in the recovery cafe model, so they contacted us and they've been coming to Spokane. They've been coming to Newport. We stay in contact by email. They're just trying to absorb as much information as they can. It's been really great, and we've been contacted by Pullman. We've been contacted by the EWU campus. A lot of people are really interested in the pop-up idea.
I just Googled the Spokane part of the website and it looks very nice. It looks really good.
Is that on the community minded website?
It is on the, let's see, Recovery Cafe Spokane.
Yes.
Yeah, very nice.
Mhm.
Have you had
More
any
than
trouble keeping organizers or facilitators involved as far as running the cafes?
I'm sorry, I missed the first part of that. Can you repeat that one more time?
Have you had any difficulty keeping facilitators or the people who run the meetings involved or signing them up?
So we're kind of a mix of staff, the staff that facilitates the recovery circles and members. We've had a couple of long-term members over the years that become facilitators and are still facilitating recovery circles. To answer your question, no. It seems like a lot of people that get involved stay involved, and we try to encourage a lot of member-led, whether it be a training, a class, facilitating a circle, which what kind of things they want to see happening in the cafe. We try to make that as much member-led as possible. There's a little bit of a process to becoming a recovery circle facilitator, though. We encourage them to be either a certified peer counselor or a CCAR trained recovery coach, or both. And that the CCAR training is something that we offer in-house at the Spokane Recovery Cafe. There's myself and another staff member are trained to train that curriculum.
Other questions from the group? All right. Well, Eric, thank you so much for being here to present to us. I think this is an amazing program, and I'm excited to hear that it's taken off so quickly in Newport. It is so hard to get services in surrounding counties, so I
Yes.
just think that's amazing.
Yeah, there's definitely a hunger for it up there. I could see it during the community events that we held. It just want something in addition to what they have up there for recovery support.
Yeah, Eric, it looks great. I've been looking at the website as we've been talking here. Thank you for being here.
Thank you very much for having me. I appreciate it.
All right, so we will turn to Ashley and the administrative update on the Spokane County opioid settlement funds.
Thank you, Andrew. I appreciate that. And so I just wanted to give an update, as I know we've presented kind of some of the priority areas and that process of identifying priority areas for Spokane County's opioid settlement funds in previous meetings. And so I wanted to give a brief update of kind of where things are in that process. As you can recall, a couple months ago, priorities were identified and approved through our Board of County Commissioners in 4 different areas. One area was to build out a crisis relief and sobering center as a part of our Spokane Regional Stabilization Center campus to add to that continuum of care. And they have committed funding to do so, and that is in the works currently. And so a lot of county work is going on regarding the space and availability on that campus and what is needed to either use an existing structure there, or if we need to create a new structure for the provision of those services. So that obviously will take a little bit of time, and the county is hard under work on that. And so one of the other priority areas was funding to support immediate sobering and triage services in our community. There was an RFP that was put out for that service, and the selected agency was STARS, Spokane Treatment and Recovery Services in Spokane. And so we're currently in the contracting phase with them, so working out the finer details of that, but in efforts to get sobering services more immediately available for our community, knowing that this crisis relief and sobering center will take a little bit more time, and knowing the need exists currently here now. And so I'm hoping that later in fall, I can have more information about when the anticipated start of those services will be, and a little bit more about the triage component to that as well. Third was an investment for long-term housing support for parents and caregivers of infants affected by neonatal abstinence syndrome. And we put out an RFP for that as well. And Maddie's Place was the selected proposal for that RFP. Maddie's Place, as I believe we've talked about previously here, is an existing facility within Spokane, a pediatric transitional care facility, treating infants affected by neonatal abstinence syndrome and offering support services for parents and caregivers of those infants as well. And they were awarded, and that was actually executed, I believe it was 2 weeks ago now, through our Board of County Commissioners to receive funding to help them build out that long-term housing support to assist in that continuum of care and stability and recovery for parents and caregivers with infants affected by NAS. And then the fourth one, and not to put anyone on the spot, but Chris, if you want to understand, Sheriff Thompson, if you want to speak to this at all, you can, was a data analyst with the Sheriff's Department. And I'm not sure if that position has been hired or is still in the process of that.
Certainly. Actually, we just filled the spot with an analyst. We're working through the reporting requirements for that position. Obviously, they were hired into the fentanyl dollars to start tracking ingress and egress of narcotics through Spokane County, opioid or overdose-related deaths. The harder lift is obviously going to be when we start talking about drug abuse addiction, trying to figure out how we as law enforcement be able to track that. I don't believe that's going to be within our realm to really track that appropriately. I think that's going to probably fall into regional health, some of those areas that we'll be working with to provide information to based upon law enforcement incidents related to narcotics.
Wonderful. That's exciting news. Thank you for that update. And sorry to put you on the spot, but glad you were able to speak to it.
No worries.
So another very important priority area for our county to get more comprehensive data and information about what is going out into our community, what is occurring in our community, and so we can be more responsive to those needs as the data directs us. And so I just wanted to give that update. I don't know if there's any questions or comments about the opioid settlement funds.
Thanks for the update, Ashley.
Yep.
Of course. Hopefully
All
more
right.
soon.
We'll go to Jessica with her crisis system data dashboard update.
Wonderful. Thank you, Andrew. I know that Nancy's going to be pulling that up shortly, but I'm here to provide an update on the crisis data dashboard for Q2, covering April through June 2024. And Nancy, let me know if that's not working on your end. I know that we're having some issues over there, and I can absolutely share my screen to share that, to provide that. Okay. Here it's not working, so give me a second. I'm gonna share my screen. So Nancy, if you wouldn't mind stop sharing your screen and I'll share mine. Thank you for bearing with me as that we go through some technical challenges here. Can everybody see that all right?
Yeah.
Yes.
Perfect. So for Q2, again, covering that April through June 2024 timeframe, we saw overall increases in most areas that we report on our crisis data dashboard. So we will go through those a little bit more specifically in some detail here. So if you look in the top left corner, the number of high utilizers, we saw a pretty significant increase compared to Q1 of 2024. There were 79 more high utilizers in this time frame. And more specifically looking at that, there were 48 more high utilizers for the regional crisis line and 31 more high utilizers for other crisis services. So a big increase in that area for sure. We also did see an overall increase in the number of individuals served, as well as the number of crisis services provided within the Q2 of 2024. We provided services to 100 more individuals and totaling about 291 more services provided within that time frame as well to those individuals. Another area that we saw increase was the number of mobile rapid response encounters, formerly known as mobile crisis response encounters. The most notable increase was seen in Spokane County with 538 more mobile rapid response encounters being provided within, when you compare Q2 of 2024 to Q1 of 2024. The regional crisis line stayed about the same in terms of number of calls received, and all within the required timeframes with low abandonment rates and average time of answer. And then when you look at the investigation outcome, so that bottom right corner, all those numbers stayed fairly steady as well, with most of the investigation outcome most often being resulting in initial detentions, with the second highest being diverted to other resources. So not needing that involuntary treatment act, and they've had other resources that were able to meet that need. So overall, fantastic work being done in our community, serving more and more individuals, providing more services, and happy to be able to report on that. Do we have any questions related to the crisis data dashboard for Q2 of 2024?
Yeah, I was looking at this yesterday, and Melina, I'm a newbie on the board, so I'm still trying to learn if that's an individual or if that is the rest look like an acronym. So is
Yes.
that an individual?
So as you will see, each of the high utilizers section has those couple of different categories. So the Amera Group Coordinated Care, Community Health Plan of Washington, Molina, and then the SCRBH, which represents our organization, are all payer sources. So Molina is a Medicaid health plan, and we just sparse those out so each plan can see the number of their funded individuals that are high utilizers of services, so they can provide follow-up and care coordination if necessary to reduce that number. Any other questions?
Thank you, Jessica.
Yes,
Thank you. All right, back to you, Andrew.
All right.
Shared my screen.
We'll immediately go back to Ashley there, ping-ponging back and forth on the crisis system update.
We like to switch it up a little bit so you don't have to hear one of us talk and drone on for too much at one point in time. So thank you guys. I just wanted to provide some updates about our crisis system as it relates to a lot of the redesign that's been occurring. There's been key parts of legislation that have really worked to redesign our crisis system, and that was House Bill 1134, House Bill 1477, a lot of different legislation that has spoken to different components of that. One of the biggest components of that has been onboarding of 988 system in Washington. And so, as you know, we do have a local 988 provider. It's actually the same provider that operates our regional crisis line, our 24/7 regional crisis line, and that's Frontier Behavioral Health. One of the biggest updates is that recently, at the end of August, Department of Health, who oversees 988 implementation and contracts within our state, as well as the Healthcare Authority that oversees our behavioral health organization, administrative service organizations, and the regional crisis lines in our state, put out a joint policy statement about next steps. There's our agenda right there. Next steps for alignment of the 988 and the RCL systems. And with that policy statement, they indicated that, the plan for our state moving forward is that 988 Suicide and Crisis Lifeline will be the entry point for the public to receive those services, whether that be services over the phone. I know they're working on text and chat capabilities as well. Or if someone's needing more assistance and dispatch needs to occur. And so really looking at 988 crisis lifeline counselors working with help seekers to identify the need for dispatch and the level of acuity, and then communicating that to the RCLs in the future in the help seekers region to better dispatch those mobile teams that can better respond to an individual if an in-person response is required. And so RCLs, the policy statement indicates that the plan for RCLs is to be more of that regional coordination, in-person response, dispatching crisis teams, as well as the direct entry point for individuals like emergency department social workers, first responders, community behavioral health professionals, kind of a professional connection point for professionals requesting assistance for individuals within our community. And that kind of ties into some of the other plans that the state has been working on for mobile crisis response. The state's really trying to get away from utilization of our designated crisis responders, that highest level of intervention that could potentially lead to Involuntary Treatment Act evaluations, and really wants to be able to send our mobile crisis teams, now referred to as Mobile Rapid Response Crisis Teams, MRRCT, a longer acronym, as well as, they're working on implementation of community-based crisis teams that might look a little different. So that could be, fire department, that could be non-necessarily behavioral agency related organizations, but that are partnered or contracted with the BHA to provide those immediate outreach services. And so they're really looking to build out those two types of teams, community-based and mobile rapid response-based crisis teams, as well as looking at, as part of some of that legislation, endorsement standards to get those teams endorsed if they want to voluntarily go through that process, which would allow them to be some of the first point of contact for some of 988 calls that might need that more immediate in-person response. Again, this is all in efforts to have someone to call, someone to go, and someplace to be for individuals in our community. So obviously 988 and RCL is someone to call. Our mobile and community-based crisis teams would be someone to respond. And then we're also looking at someplace to be for individuals, and that, you can see with the investments in the Crisis Relief and Sobering Center, having a direct access point for individuals and places to receive those immediate crisis services. I'll pause here because I just talked about a lot to see if there's any questions or comments on any of this.
So this transition of trying to rely less on the designated crisis responders, there kind of a time frame on when looking to change more to the rapid response, or is this already happening?
It's already happening. And I think it's been happening for a couple years within our community, and really trying to have, the ideal model is a crisis responder, a crisis intervention specialist, partnering with a peer, outreaching for that first engagement to provide that level of service to someone and really meet needs in multiple different ways, and really try to steer away from law enforcement engagement if it's not needed at that first initial step, to get someone the help that they need. And then going to the more acute levels of care if that is required after that initial engagement. What one of those challenges is for our rural communities, having that kind of dyad team is not always as feasible given staff shortages and the availability of staff that can provide those services. And so it might look different in each of our counties that our region serves. But really trying to go towards that initial engagement. How can we get people out the door to meet someone in that crisis more rapidly and without more restrictive means if necessary?
Other questions?
No, thank you, Ashley.
Absolutely.
All right. Continuing the back and forth, back to Jessica.
Thank you, Andrew, and thank you, Ashley, for that update. I'm going to briefly provide a quick update on our ISW program, Initiative for Student Wellness. This is a program near and dear to our hearts here at the ASO, and something that we have presented to you in the past. Just wanted to give you an update about how things are going. As previously shared, in the 2023 school year, we added 7 schools. So we expanded our program from just being in the West Valley School District to span across 5 different school districts, including the Centennial Middle School, West Valley High School, Cheney High School, East Valley High School, Riverside High School, and then Freeman Middle School and High School. So due to adding so many schools over the last year, we're not adding any more for this school year. We're mostly working on improving the program and in the already established schools, and making some minor changes as we go along to meet the needs of the schools and the districts that we are a part of. All the ISW schools are currently working to begin their screenings for the selected grades in each school, with Freeman already beginning their screenings, which is very exciting. My wonderful team, Katie and Josh, have been actively working with the schools and providing support as they get ready to kick off their screenings, and have been on site providing support when they do start those screenings, just to make sure that they have everything they need to be successful. We are also working to finalize our Initiative for Student Wellness 2023-2024 annual report, and we will have that to share with the BHAB shortly. We're really excited. It's been a lot more work with the added schools to compile all that data for each school, and I think you guys are going to really enjoy the report that my team has put together, and excited to share that with you here in the future. So just a brief update. Things are going well, up and running, and we're excited to kick off another school year with this program, and keep helping students through this unique and innovative program that we have. Any questions?
Can't wait for the reports to come back to see what's going on.
Yes, they look beautiful, by the way. Shout out to Katie, who's on this call, for making everything look amazing for our department, and really diving into that data so we can provide a comprehensive review of what's going on within our school systems related to the youth that we have screened through this program and provided follow-up services for. So we are excited to share that with you all, and very proud of everything that's been accomplished.
Well, thank you, Jessica. I'm looking forward to that. The student wellness program, everything we do in the schools, it's just amazing. So I'm excited to keep hearing about those updates. All right, Tom, Consumer Consultation Panel.
Okay, I have here my CCP minutes from July and August. First, I'll do July. At this meeting, our guests were Kaylin Roy, liaison to the BHASO and CCP, and Gail Kogel of the Office of Behavioral Health Advocacy. Brent Smith, CCP chair, facilitated me. Also attending were CCP members Tom Ghost, Aaron Smith, Robin Segner, Sarah Leak, and Sophia Alexander, and Alvin Pittman. The online July 24 CCP meeting is called to order. The June 2024 CCP meeting minutes were read and approved. June's Behavioral Health Advisory Board meeting had already been reported on, so there was no Behavioral Health Advisory Board report. Sophia mentioned that she talked with Gail about putting a pop-up on a table at CCP events with CCP info. The CCP logo and mission will be on the sign. It was mentioned that the CCP is still working on purchasing T-shirts. It was also mentioned that we intend to purchase a microphone for around $29.99. After this purchase, the CCP still has approximately $230 left in its budget. Gail said that she is moving into a new office located on 312 West Sprague. The CCP can possibly hold meetings there. It was known that the Evergreen Club Fun Run is on Saturday, August 24, 2024 at Riverfront Park. The CCP should arrive by 9 a.m. It was noted that the CCP Facebook page is still up and running. We discussed the coming Santa picture event. We intend to do the pictures on December 7th and 14th or December 8th and 15th. Some possible locations are Gail's office, the Hive, and Brent's church. It was mentioned the best time to do pictures at the Hive will be between 10 a.m. and 5 p.m. The Hive has a parking lot also. Brent suggested we do Grinch photos as well as Santa pictures. Also, it was suggested that in November, Brent do a trial run on his computer for the Santa event. The next CCP meeting will be held online on Monday, August 12th from noon to 1 p.m. And then I have my minutes for August. At this meeting, our guest was Kaylin Roy, liaison to the BHSO and CCP. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Ghost, Aaron Smith, Robin Segner, Sarah Leak, and Sophia Alexander. Gail Kogel had an excused absence, and Alvin Pittman had resigned. The online August 2024 CCP meeting was called to order. July CCP minutes were read and approved. Discussed the July 2024 Behavioral Health Advisory Board meeting. At this meeting, there was a presentation of Behavioral Health and Community Services Navigator Program by Chantel Liz, Executive Director of NAMI Spokane. She said that they're asked how to navigate mental health resources. Also, they are asked how to help loved ones and what they can do with service and support areas. They are asked about domestic violence and use domestic violence techniques to deal with this. Chantel said they are working on a certified peer counselor program and also a text line. Next year, they're looking at how to increase volunteers and how to partner with other groups. They're also working on how to get assistance downtown. Google Dynamics Spokane for info. There was an administrative update by Ash McGee. She said that Sacred Heart Providence Psychiatry Center for Children and Adolescents is closing on September 7th. However, there are a lot of other services for youth, such as INBH, which has 25 beds for youth ages 13 to 17, and REACH, who will use psychiatric services, Spokane for info. There are also outpatient services for youth. Jessica Thompson gave a report about the Recovery Cafe in Newport, Washington. This cafe has limited hours and does not have a permanent location. They're working on longer hours and additional support. The cafe seems to be beneficial. There was an RFP update by Jessica Thompson. There are 2 RFPs in progress. One is support for housing for caregivers for the infants having substance abuse issues. The other is for support for sober and tread services. The RFPs will be presented to the Board of County Commissioners. The CCP then discussed their budget. May be able to purchase T-shirts for next year. Consumer consultation panel staff will be on the back of the shirt. Also, you purchase a speaker for CCP events at the table of the Evergreen Club Fun Run. Under new old business, it was mentioned that Gail Cole was moving to a new office, which may be available for the CCP meetings. Also, the Evergreen Club Fun Run is on August 24th. The CCP will have a table at the event. The CCP should arrive by 8:30 a.m. to set up the table. The event starts at 9 a.m. Sophia said that she has candy, but that the CCP should bring their own drinks. Brent said that he has tested the CCP's new speaker and it works fine. It was noted the cost of CCP Santa pictures is still $5. Brent confirmed that we can do the Santa pictures on December 7th at his church from 1 to 3 p.m. The church is United Methodist Church on Garland and Driscoll. The CCP should arrive by 11 a.m. The CCP is still not sure about where to hold the event on December 14th. Also, it was noted that Creme 2 may be able to film the event. It was mentioned that Brent should be sent a reminder in November to do a trial run on his computer to prepare for the event. The next CCP meeting will be held online on Monday, September 9th, 2024 from noon to 12:30 p.m. Meeting was adjourned. Those are my CCP minutes. Hello?
Thank you, Tom.
Hello?
Thank you, Tom.
Okay.
Yeah.
Those are terrific. All right,
Thanks, Tom.
board comments or public comments?
I have a comment. I, Craig W. Davenport, am saying this letter of resignation is termination of my membership on the Behavioral Health Advisory Board effective December 31st, 2024. And I have a plethora of health problems. I've seen a lot of improvements in the mental health system. I've advocated for a lot of improvement, like we all have on the board. I've seen improvements in some things. I've seen regress, maybe like closing of the Sacred Heart's children and adolescent psych ward and closing of Daybreak. I just like to advocate some things like the group homes, more group home safety. They shouldn't mix the prison population with the regular mental health crowd in group homes. I've known people at Milford House and Blair that were in prison, and I've had problems with a lot of people have had problems with them. In Minnesota, where I went to school at Concordia long time ago, they separate the prison population from the mental health crowd in Minnesota. They have halfway houses for the prison population and group homes for the mentally ill. They should be separated here in Washington too. The biggest advocate in Minnesota was Paul Wellstone. He was a great congressman and he was a great advocate for mental health in Minnesota. We've had good advocates here in Washington too for Tom Foley and so forth. I would like to hear more about wrongful death lawsuits against mental health, about some of the people who have died in group homes from suicide, like my girlfriend and Randy Kramer. He committed suicide at 54. Leanne Helm, my girlfriend, in 1995 at 43. And I just found out 2 weeks ago, a friend from Troy, Montana, which is right next to Libby, Montana, a friend of mine, Timothy O'Neill, committed suicide at 42. I think there needs to be more done about suicide prevention for older mental patients like me and Leanne and Randy, and how the system had failed them. We've got to support our weakest link in society. And that begins the youth as well as the older mental health population. I will really miss Doug McPhee as a chairperson ages many years ago, and Nancy. I'll miss her, and Jessica and Jamie Gadd. I wish I could keep in touch with you, Nancy. Is that okay if I keep in touch with you through email?
Yeah, that'll be wonderful,
Nancy?
Craig. Yeah, that'll be
Okay.
wonderful.
I've been on the board since January 2013, and before that, I was on the CCP board from January 2002 to December 2012, and on this board from January 2013 till December of 2024, 11 years. I've enjoyed my stay on it. We've done a lot of work. A lot more work needs to be done to ensure the mental health of our whole society. And I thank you very much for my tenure on my term on the board. Thank you.
Well, Craig, we're going to miss having you on the BHAB, but I appreciate all of your advocacy, and I appreciate your comments on where we failed and where we need to keep going. So thank you
Yeah,
for that.
yeah.
Any other comments?
I would like to raise a comment. This is Gail Kogel. Many of you know me and the work I do. And once a month I host a behavioral health forum. That's on the second Wednesday of every month from 3 to 4:30. At the Fitchburg Family Youth Services Roundtable Partnership Roundtable. Anyway, it comes out of, it's for more intensive youth services. We were discussing, it was brought up that there seem to be more and more gaps in child and youth services. So that's going to be the focus that I'm going to have on October 9th. I can send something out to Nancy, who can send it out, but I really want to have this discussion.
Thank you, Gail. I'll look forward to that email, and I appreciate if you send that to Nancy and bringing that to the rest of us. There've been a lot of changes in youth mental health services in Spokane recently, and not for the better. Any additional comments?
Yeah, Craig, this is Kim. You'll be missed on the board. You've done a wonderful job. I think certainly you've been on the board longer than I have, so you will be missed greatly.
Well, thank you, Kim. Thank you very much. I greatly appreciate that comment and confirmation.
And
echo that as well.
Yeah, thank you, Gail. I was about to say the same thing, echoing those sentiments. You've been on the board as long as I've worked here, so thank you for your advocacy and all your work and being part of this.
Thank you, Jessica. Thank you.
All right, so we've got a next meeting, our last meeting of the year, scheduled November 25th right now. So we'll see everyone back here then. Do we have a motion to adjourn the meeting?
This is Kim, so moved.
Thank you, Kim. Second?
Second.
All right. Thank you, Craig. All right, we will be adjourned. And thank you, everyone, for your time this afternoon.
Thank you.
Thank you.
Thank you.
Thank you, yeah.